Hi everyone. Today we're going to talk about anti-rabies vaccine. So let's dive into the amazing world of the anti-rabies vaccine today. What is the anti-rabies vaccine? This vaccine protects you against a viral infection which is known as rabies. It is a very severe disease which affects the central nervous system, and it is almost always fatal once symptoms develop. But the good news is that the anti-rabies vaccine is highly effective at preventing rabies both before possible exposure and also after possible exposure. The vaccine works by producing what we call neutralizing antibodies in your body. These antibodies will protect you from the virus, and the vaccine is considered safe. We are going to discuss two types of administration of this vaccine. First of all, we have pre-exposure vaccination, and then we have post-exposure treatment with the vaccine. Let's look at pre-exposure rabies vaccination. This type of vaccination is recommended for people who are at higher risk of encountering the rabies virus. So, we are talking about people like veterinarians, people working in laboratories who work with the virus, hunters, and also travelers going to certain areas where they might be at risk of getting infected with the rabies virus. With this type of vaccination, you build up immunity before you are potentially exposed to the virus. And studies show that after a booster dose, 97% of immunocompetent individuals had protective antibody levels after 10 years, so it is long-lasting. Now the second one is the post-exposure prophylaxis. As I mentioned earlier, the rabies vaccine is highly effective at preventing rabies if administered soon after the exposure. It is never too late to start the treatment, even if the exposure happened weeks or even months ago, because rabies has a very long incubation period. The incubation period is the time between exposure and the onset of symptoms. It can vary from a few weeks to several months, with an average of 2 to 3 months. However, the incubation period can be as long as 10 years. Now, although this vaccine is highly effective, it does not work once the symptoms appear. Once the person starts showing symptoms of rabies, there is no treatment available. That's why post-exposure prophylaxis is so important. So, who needs the post-exposure prophylaxis? Basically, anyone who has been bitten or has come into contact with a potentially rabid animal. So this can be a dog, a cat, a bat, a monkey, a fox, a raccoon, a skunk, or any other wild animal. Rabies is most commonly transmitted through the saliva of an infected animal. So if an infected animal bites you, scratches you, or licks an open wound or comes into contact with your eyes, nose, or mouth, you are at risk of getting infected. Now what happens if a person is exposed to rabies virus? Immediately wash and flush the wound thoroughly for at least 15 minutes with soap and water. This is important regardless of whether the animal is a pet or a wild animal. After that, seek medical attention right away. A doctor will assess the risk of exposure and determine if post-exposure prophylaxis is necessary. The doctor will also administer the vaccine if needed and provide further guidance. Now, are there any factors that affect the effectiveness of the vaccine? Yes, there are a few. First of all, as mentioned, the wound management. If the person doesn't wash the wound properly with soap and water, it can reduce the effectiveness of the vaccine. Also, if the person is taking concomitant medications, for example, corticosteroids, this can diminish the effectiveness of the vaccine. Another important thing to know is that the anti-rabies vaccine has to be given as an intramuscular injection in the deltoid region of the arm. It should not be injected into the gluteal muscle because this can lead to a reduced immune response. Alright, thanks for watching. If you found this video useful, please hit like and share with friends and family. And don't forget to hit subscribe to get notified on new videos. Stay safe, stay healthy. Bye-bye.